Borderline personality disorder is characterized by the abrupt shifts in mood, lack of coherent sense of self, and unpredictable, impulsive behavior. They can also have a deep sense of emptiness and unstable self-image, a history of turbulent and unstable relationships, dramatic mood changes, difficulty regulating negative emotions, self-harm behavior, and recurrent suicidal behaviors. They tend to be uncertain about their personal identities, their values, goals, careers, and even sexual orientations. They can't tolerate being alone and make attempts to avoid feelings of abandonment. These fears lead them to be clingy and demanding in their relationships. They tend to view people as all good or all bad and abruptly shift their views of others from one extreme to another. They tend to act in impulse, such as eloping with someone they just met. Often these impulses are unpredictable behavior and often self-destructive, involving cutting, suicidal gestures, and attempts, especially when underlying fears of abandonment are high. Behaviors such as cutting and substance abuse and lashing out in anger may be an attempt to controlling these intense negative feelings.
ADHD is a common mental disorder that begins in childhood and can continue through adolescence and adulthood. It makes it hard for children to focus and pay attention. Causes are smoking or drinking during pregnancy, birth complications or low birth weight, exposure to lead and other toxic substances, extreme neglect, abuse, or social deprivation, food additives like artificial coloring, which might make hyperactivity worse. Genetics are linked to ADHD. Symptoms for ADHD is getting distracted easily or forgetting things often, fidgeting and squirming a lot, having trouble controlling emotions, having trouble finishing tasks like homework and chores, having trouble following directions. Your child must show at least 6 symptoms in the beginning 12 years of their life to be considered ADHD. Treatments consist of medications and different kinds of therapy.
The word bipolar is currently used to describe unpleasant people that are considered bitchy. However, bipolar disorder is characterized by extreme mood swings and changes in energy and activity levels. Mood swings typically shift between heights of elation to the depths of depression. Some people with bipolar disorder experience mixed states between mania and depression. In a maniac episode, the person experiences a sudden elevation or expansion of mood and feels unusually cheerful, euphoric, and optimistic. They also experience inflated sense of self-esteem, speak very rapidly, and fail to measure the consequences of their actions. People suffering from bipolar disorders are often misunderstood and end up being labeled as hormonal, mental, insane, and unstable. Some famous people such as Catherine Zeta-Jones, Demi Lovato, Kurt Cobain, and Britney Spears have publicly said that they suffer from this disorder, contributing to raise awareness for bipolar disorder.
Post-traumatic stress disorder is a prolonged maladaptive reaction that lasts longer than 1 month after a traumatic experience. High rates of PTSD are found among earthquake victims and hurricane survivors. The traumatic experiences most commonly associated with PTSD are serious motor vehicle incidents. Stigma associated with PTSD is often words like crazy, angry, violent, and dangerous. Veterans suffering from PTSD are often stigmatized this way. About 300,000 American soldiers returning from the war zones in Iraq and Afghanistan show symptoms of PTSD or depression. Several classic war movies as well as media coverage have helped create the crazy war vet stereotype, which is inaccurate. PTSD is not characterized by psychosis or violence. Rather, symptoms of PTSD surround coping with the memory and implications of a traumatic experience. People can have PTSD and still effectively do their job, even a military job, and maintain the normal relationships with family and friends. PTSD is a manageable and treatable diagnosis. PTSD is very responsive to treatment. There are several different types of treatments developed for different types of people, which have all been found to be effective.